Now have on the phone line the program manager of the National STI and HIV/AIDS Control Program, Dr. Stephen Eyisiado, to help us to discuss this issue further. Good afternoon, sir. Thank you so much for joining us on News Hour.
Right, thank you. Good afternoon.
Yeah, Doc, so from the statistics, we know that the youth have been infected most. Is it that the youth are engaging in sexual adventures with impunity? What accounts for this number?
Okay, so I think part of the reason why the youth are affected is ignorance, lack of knowledge. You know, when we used to embark on campaigns, the people who are old today were younger. Now, fast track, they are older. There are new people who were babies at that time, and they now are adolescents, they are teenagers, they are young adults. But in their time, they are not seeing the campaign on television, they are not hearing on radio, the talk is not active. So the reason is that some of them are not deliberately contracting, which is they are ignorant, they are unknowingly, they are engaging in risky behaviors. Today, when we talk about men who have sex with men, a lot of them are young people, and they don't know that they are putting themselves, you know, at higher rates. Now, one of the things that we are observing for young people, females, they use emergency contraceptives. It's because they have unprotected sex. If you use emergency contraceptives, you protect yourself from pregnancy. You prevent pregnancy, but you are not protecting yourself from sexually transmitted infections and HIV. People are hardly talking about condoms today. Okay, so all those things contribute to the spread among young people.
So now let's look at this issue. We used to have this kind of sensitization on the various media networks and other sources, but now it seems that we hear nothing about HIV, AIDS, but we get to know more about COVID-19. So would you attribute, you said that youth, they are ignorant, partly ignorant, that's why they've been infected with that high numbers. So will you say that because COVID, the attention has been shifted on COVID and we've left HIV, AIDS just in the bin, that accounts for the staggering figures that we've recorded within the 6 months?
I have to state that COVID has actually contributed to a worsening of a lot of issues and a lot of disease conditions. For instance, many people have died more indirectly from the effect of COVID because of the attention that we gave to COVID. But that is normal. Prior to COVID, the problem was lack of funding for prevention campaigns. You see, currently, a large part of our national response is dedicated to providing commodities for those who are already positive. So, treatment. And then a lot of money goes into test kits for testing. But we need to prevent new infections through prevention campaigns, education. This we used to do with funding. So the media institutions and all that, they don't work free. They need finance, they need money to be able to air the programs. And now there's no money for that. There's even no money for the general public activity and all that. So that has contributed to the reduction in the bar as far as prevention education is concerned. Now, because of the focus on COVID and other new needs, we are finding other ways, innovative ways. For instance, we are trying to incorporate HIV education in Ghana Education Service curriculum, so that whilst people are in school, they will be learning about HIV and STI. That one, you don't need additional money. We are trying to work through adolescent and youth-friendly labs. While they are learning and playing, they also learn about HIV. We are trying to work through some NGOs like PPAG. They have launched what we call the Young Casa. It's an app. You call up into it, and then you can get interactive information on HIV, STI, issues about family planning and all that. So those are some of the ways. But the conventional method, you need resources. Even if you use social media, you need to boost the message. So we need funding for the prevention component. We cannot continue to be identifying positives, putting people on treatment, because there's a cost of treatment. We need to prevent new infections so that at least if we can manage those who are positive, they will transition out from other conditions when they grow old. Then we can be able to achieve a country free of HIV.
Okay,
so we need dedicated funding.
All right, so
Yes,
certainly this is a platform that or a channel that you also sending out the message loud and clear. So now let's touch on the 95 target. What is it about, and can we reach the set targets by 2025?
The 95 targets were set out specifically to ensure that we achieve epidemic control by 2030. It means that by 2030, HIV should be a condition no more of public health importance. And then there will be no one who should be living with AIDS. There may be a few people living with HIV, but they don't have AIDS. Okay, now to achieve that, you should first of all prevent new infections. The second thing is that you must identify everybody who is HIV positive. So the first 90 says that of the estimated 350,000 people who are living with HIV today in Ghana, we should find at least 95% of them. If you identify them, put 95% of them on treatment. That is the second 90. The reason is that if you put 95% on treatment, with the medication, they get virally suppressed. The number of viruses in the human being reduces to undetectable levels. That is the third 95. So 95% of them to have viral suppression. Once you achieve that, even if they have unprotected sex, they will not transmit, because we say undetectable is untransmissible. It's like vaccination. When you vaccinate a certain percentage of the population, we get herd immunity. Then there will be no transmission. So this is why the 95 was actually agreed upon in Ghana, actually adopted it. And where we are now is that we've done 71, 99, and 79. You cannot boast about the second 90, where we are at 99, if you've not found all the 95% in the test. So we've done 71. We need to look for the rest and at least achieve more than 95%. Then if you put all that identified on treatment to make sure that they are virally suppressed, then you are getting there. Well, at this momentum, we think we can get there, but on this condition. Number one, we should have the commodities to test the people. We should be able to have the treatment for the people. And we should have the reagents and the equipment to monitor the people on treatment. All of us in Ghana must work to reduce stigma and discrimination against people living with HIV. Because if you continue to stigmatize people, they will not accept testing. Even those on treatment, they will hide. They will spread it quietly. They will not cooperate with the health worker or the health system. So we need to deal with all forms of violation and infractions on the rights of people living with HIV. We have to create an enabling environment. We have to support them so that they can continue to be on treatment. We need to deal with prayer camps and people who are claiming that they have treatment and healing people, but that is not true. Some people are dying. They take them off the medication and they end up dying. We need to do some work with the prayer camps and religious organizations to remove such barriers. We need to continue to advocate for more resources so that Ghana can have its own funding for HIV.
Okay,
the
then.
Ghana AIDS Commission has set up an AIDS fund. It's yet to be operationalized. We must all talk about domestic resource mobilization so that we can use that to cover these things, so that we don't depend only on partners and donors.
All right, and Dr. Stephen Eyisiado, thank you so much. I'm afraid that's all time.